So I think the biggest challenges for me have been that I have had to do many visits over the phone, and particularly visits with teenagers over the phone can be very tricky because you have to make sure that the teenager is away from their parent and able to talk to you in privacy. And I think in some cases, especially in the safety net setting, that's not possible. And so the children end up not telling you really what's going on. So I've really been trying hard to have teenagers come to well child visits. And I try to get a sense if they seem to be struggling with anything, to have them come in and to separate them from their parent in a way that I can clearly see that they're separated from their parent and that I can talk to them alone. So that has been very, very challenging during the COVID-19 pandemic. The other thing is people losing their insurances, switching healthcare systems, and if they need mental health support, that puts a lot of delay in getting that support. The other thing is if the support is over the phone, again, when people are in close quarters, they may not necessarily be able to be in private with their therapist, and that can be very, very challenging. So I have been trying my best to see these patients face to face with what my system allows me to do, especially now that LA is not in a huge surge right now. I'm trying to see my patients face to face as much as possible, but it has been very challenging. And I know that during the COVID-19 pandemic, uh, LGBTQ people are often more living with their families and not accessing the same safe spaces that they could before. And so many of them feel that they cannot be the kind their the gender that they prefer to be at home. They cannot express that, or sometimes they feel that they cannot reveal their sexual identities at home, and that's been very, very challenging to address and heartbreaking for me also.